As the October's mental health awareness draws to a close, stakeholders are calling for urgent reforms to support millions silently suffering across Kenya. With rising economic pressures fueling stress and isolation, advocates say it's time to integrate care, reduce stigma, and restore dignity, especially for vulnerable groups like adolescent girls. In Nairobi, Kibra settlement, Ida Akot's life changed the day her community program shut down. The initiative, funded by USAID, had helped girls stay in school, avoid early pregnancies, and heal from trauma. For Akoth, it was more than a program. It was a lifeline. It offered emotional guidance, mentorship, and a safe space to grow, but that hope was short-lived.
Nilikuwa volunteer, a mentor, facilitator, na vile nilikuja it was so abrupt, and kukuja kwake kupata mnastopishwa kazi au juu tenda wapi, utaanzia wapi, there's nothing ulikume, yani kama ulikuwa tu kumesave pata kwa ulikuwa ushatumia last year, like it was a start of the year, then all of a sudden kazi imeisha, unaona. So most of the people walikuwa disturbed. Actually find out like kama volunteers wenye tulikuwa hapo, but like hatukuwa tunajua tuanze wapi tumalize wapi. Unajua ingekuwa tu ni organization moja pekee inge make sense, ali ningesema nitaenda kutafuta kwingine, but to find out it affect most organizations in Kenya, in Africa, and we find out we had no option but just to console ourselves na tukue zile za ni sawa. Itabidi kama ni mtu anaweza ingia business, kama ni mtu anaweza enda Ocha, and I even have my fellows wenye ilibidi waende Ocha, ilibidi wengine wafanye nini, wa move out kwa nyumba zenye walikuwa naishi. Life ili change too, because the amount of money ulikuwa na earn says mimi huwezi meet needs zako tena. Napata mtu amehama, watu walikuwa wanasoma shule nzuri, sasa inabidi rudi chini, yani life irudi tu chini, I start again from obviously from zero, but you have to start again. Lazima uanze ku replan tena. Na ilisumbua tu mentally, cause you find out mentally people are not okay, you affect emotionally, physically, mostly emotionally. You are disturbed anzia wapi, na vile kutafuta job most in our country is not something easy. Unaweza kuwa na papers na kila kitu, but pale utaanzia will accept. Yes, you have the qualification, but surety haiko. Utaenda pale ufanye application, but tutakuita and days ina move na bills ziko, unaona. So ilifika point hata watu wako mentally tortured, stressed, wengine waliingia to depression, na whether you don't know who to talk to, mwenye unadhani unazongea na yeye pia amepitia the same situation. So ni kama mko tu hapo nyi wote, mko tu zile itakuwa sawa, but in this sense haitakuwa sawa so soon. So you find out like tukao tunajaribu kupatia na hopes. Nikiwa kapo nilikuwa mental health champion, facilitator. So mtu anakuja kwako, unaweza nisaidia, unaweza niongelesha, then pia uko to your stage. So you find out find it very difficult. No.
When the program collapsed due to lack of funding, everything changed. She says it has been tough trying to protect her mental health without that support.
Something that really affected me, because me talking with the girls, it was like a healing process to me. They are reminding me of my childhood process, and through the talks and everything we share, I was healing some part of me. And with them, I used to find out like hata nikiwa na start we play games, we do what, everything will be done. You know, I go home happy. I'm a mother. I'll go home to play with my son, do what, but you know, with this team of girls, they used to bring the inner you, the happy inner you. But now here comes, now you won't be meeting it. It has been a difficult journey. A Saturday will reach, and then I'll sit there and be like, I'll even call my friend. So I'll be like, aki sai tungekuwa tuko session, ona pali tuko. Then you'll be laughing and be like, aki tutafanya. You know, that's what we do. We consult each other. Aki sai tungekuwa tunafanya, aki sai, you know. But you'll be like, everything will be okay. You know, but something very hard. It has affected me emotionally. There's like the time I heard about it, actually nililia. Like, yes, nilijua itaisha, but not this abrupt.
Experts warn that the psychological toll of a sudden job loss and isolation can be severe, but recognizing one's emotions is a vital step towards safeguarding mental health.
The first and the most important step is to acknowledge that you have been laid off. The next is to be in touch with the exact feelings that you are going through. Is it anger? Is it sadness? Is it anxiety? Is it fear? And the other one is to ask, where is that feeling manifesting in your own body? Is it making you sweaty? Is it making you shake? Is it making you probably not reason well, don't concentrate? Is it giving you physical pain? You are now trying to locate where it is in your body, because we say what happens in the mind affects the way we feel and affects the way we experience that.
As Mental Health Awareness Month concludes, advocates are urging greater investment in grassroots programs, particularly those supporting girls in underdeserved communities.
One in this world who has the capacity to withstand frustrations, disappointments, and they are also ready and open to facing such, and they can pull through to see the next day, even pull through to still love the family, pull through to even look for another job, and another one, and another one, an interview after another one, an application after another, sometimes without success. That person is building resilience. That capacity, if people could have it, there is nothing that you cannot overcome. There is nothing you cannot pull through. And take my word, sometimes people have also made decisions to leave their jobs because of different reasons, and that was the only way they would have gained their sanity. Meet most of them who are resilient. You will still find them doing something productive out there. Why? Because when you are whole, when you are functioning, you are an attraction to positive things. You are an attraction to great ideas. You are an attraction to even another employer. You are an attraction to creativity and innovation, because that mind can withstand anything. Take a step and say, I will show up. And then don't be shy to ask for help. Whether you are asking for medical help, you're asking for psychological help, psychosocial support, you're asking a friend to help you look for a job, or you're asking for some capital to start a small startup, do not be ashamed. Because any loss in our lives brings a shame, especially when we think and feel we cannot make it. And so that shame makes you not go out there. Kindly show up. And with resilience, whether you're supported or not, you can bet if you come back to me, you will still find something.
Psychiatrist facility Mathari National Teaching and Referral Hospital has reported a sharp rise in mental health cases linked to economic hardship, while substance abuse remains a key driver. Chief Executive Officer Lawrence Nderi says financial stress is now an increasingly significant factor.
Longest period, we have not had a proper discussion about mental health in this country, and it is really a burden that is dragging us behind both economically and socially. 25% of all outpatients tend to have a mental disorder, and as much as high as 40% of all inpatients, those who attend our inpatient services in the country, have a mental health disorder. So the burden is quite high. We are the premier hospital in this country when it comes to mental health services. And what we are trying to do is, if you look around the country, the service delivery in terms of mental health is quite low. And most counties, actually, we have counties that have no mental health services at all. So one of the things that we want to do as the Apex Hospital is ensure that we have enabled and capacity build the lower facilities, the counties, to make sure that they are delivering the mental health services, so that at least we can offload some of the workload from Mathari. Right now, Mathari is quite overwhelmed by some. So we need to make sure, we need to have this conversation with the county governments and ensure that these county governments have set up proper mental health services in the county, so that Mathari can be left doing tertiary services, the level 6 that is supposed to be doing according to our mandate. This is high.
According to the Ministry of Health, Kenya has only 116 psychiatrists serving a population of over 50 million. cultural dilemma, further discourages people from seeking help and deters professionals from entering the field. In response, the Ministry of Health, in partnership with Johnson & Johnson, have launched the Kenya Mental Health Project, a nationwide initiative aimed at expanding access to care and reversing troubling trends.
Focused on building the capacity to link communities to care. So how do we get our patients who are in the community screened and referred into the primary care level? How do we give basic mental health education to our frontline health workers in level 2 and 3? And then how do we provide specialist training for nurses, psychiatric nurses at level 4? And our aim is to have at least one psychiatric nurse per primary care network across the country.
Zainab Said, the Eastleigh Voice.